Hi, everyone. You're very welcome today, and thanks for joining us here. My name is Claire Harney. I work with Santegic as the principal advisor. We work on digital transformation of healthcare and all things around that. One of the areas that we'd like to focus on at the moment is single sign-on and identity management for healthcare. It's an area that with fragmented digital systems across our health system in Ireland, the amount of logins, workstations being left open in a scenario where we have multiple use workstations on wheels, for example. It's an increasingly important area for us to focus on against the backdrop of cybersecurity risk. So I'd like to welcome Mr. Preetham Gowda from AuthX. AuthX provides identity and access management for healthcare, enabling secure, passwordless single sign-on for clinical staff, and it's enabling that fast authenticated access to electronic systems in healthcare. And Preetham is a global expert in identity management, access and security in healthcare, and is president and co-founder of AuthX. So you're very welcome, Preetham, and thanks for your time today. So if I might ask and begin with asking you, could you briefly share your own background and what you've learned about the role identity plays in a complex organization such as healthcare?
Thank you, Claire, for having me here today. Definitely, this is something that has become an important thing in any healthcare. Is about how do we manage access and identities. When we started AuthX, we just started with solving like an MFS solution, but as we grew into what are we exactly solving in the healthcare, and what we learned is the systems and the identities have become so fragmented, and the productivity of the clinicians or the staff gets reduced with the password friction, and different usernames and passwords, and when they're supposed to take care of the patients, and it takes them away from the patient care. There is a lot of things to solve. It's not just being able to just being in the background and managing the identities or the access. It's also about how do we actually improve the user experience? How do we solve that? So while security and compliance is important, doesn't mean we have to compromise patient care or the user experience. This is where we have seen that AuthX can solve a lot of those issues, and what we have evolved as an internet access management is also about how do we improve the endpoint access security, the shared workstations, like different modalities, different operating systems. So this is where AuthX has learned. Also as an IAM, this is something that we have to improve along with the changing technologies, that we don't compromise user experience, security, or compliance.
Brilliant. Thanks so much. And really what I'm hearing is that, the regulation is important. Digital transformation is also important as we modernize our health systems. But then that leads to, and I must admit, I have experience of this working in hospitals, needing to log in multiple times or reset passwords and forgetting what my password is, or my password for multiple systems. And it becomes so complex, and healthcare is increasingly complex, that it's difficult then to really focus on, I guess, the importance of logging in, adding the information that you need to add so that we have good data in healthcare. That's really important. At the same time, you want to be patient-facing. And you want to spend your time delivering care, not trying to log in. And I think I mentioned earlier when we were discussing, I got stuck in a multi-factor authentication loop just this morning when I didn't have much time. So it can be very frustrating. And, in a high pressure environment such as healthcare, that can be a huge problem. So, how did we get here? When you think back, we had simpler access maybe 10 to 15 years ago. Most of what we did was on paper. And the signature was the key thing to everything. If you sign your name on the piece of paper, and actually in Ireland here, it's only recently that we have changed some of our legislation around healthcare documents and the need for a pen and ink signature, when in fact digital authentication is much stronger. we are seeing the growth of things like electronic health records. We're about to embark on a large-scale electronic health record journey here in Ireland. But some of our hospitals do have electronic records. We have electronic lab systems, patient administration systems, radiology systems. You know, there's a system for lots of different specialties as well. And the identity management at the core of all that is so important. So what I wanted to ask you is, in your view, being an expert in this area and having a good overview from a global perspective, how have access models evolved as we digitize our healthcare systems around the world?
Good question, Karen. So one of the things that really happens is as we have digital transformation happens, a lot of technologies and a lot of systems has come into play. And not everyone has adopted standards. There's no like SAML or OpenID, they have not adopted, or they have continued to remain as a legacy system with a different user and password, right? Or not being able to integrate into a single identity solution. That means the IAMs also have to adapt to that, because that will take time. The change in healthcare is slow. So how do we make sure you have a system that actually adapts to the changing technologies, right? How can you actually still support the existing technologies? So we have been able to like adopt multiple identities, but give the same user experience for the clinicians, where they have to just remember one kind of access, right? Whether it's a badge tab, or if it's not, if it's a multi-factor, can they have options? Say, let's say like if your phone is out of charge, what will you do if you're not able to receive an OTP? Are there multiple options for you to be able to like use a multi-factor? Is it really needed at this point of time when you are in a that you have to be prompted again and again? That's where adaptive authentication comes in. Being able to have an adaptive authentication depending on what options are available. Do you have to have an MFA? Can you actually trust where you're accessing from, depending on the location? When do we prompt? So all those things matters, right? I mean, of course, giving access and security, access to the patient records is important with security, but making it easier while the clinician doesn't have to juggle to like multiple usernames and password, right? Or if he has to attend to something that's urgent and he walks away, how do we make sure we protect that workstation? Like there are technologies like either like we time it out, or make sure if someone comes in, can they just log in, like tap over them, right? I just tap their badge and actually change to the session, right? If someone forgets to change, so like it's all actually like make sure it's the correct user is logged in. Or there are technologies that we can integrate to like walkaway solutions where keyboards can recognize that the user is not there and actually lock the workstation. Right? Or also like being able to like move when a physician moves from one workstation to other workstation, can we carry their sessions across? So it's the things that is required in healthcare is a little bit beyond more than an identity and access. It's about how do we make it convenient for the clinician, right? So that they can actually like focus on patient care.
Brilliant. And actually, something you said there triggered a thought. That experience piece is really important for healthcare staff of all types, because there's a huge burden on our healthcare providers, and to be caught in a loop of trying to log into multiple systems is not really where added pressure that we want to be putting on people. But it's also about the experience of the patient, because we need to log into healthcare systems, not just to add data, but also to access health information about the people that we care for. And if we can't access that information in real time, right person, right place, right time, then we've got a real problem in terms of diagnostics, treatments, all of the things that we need to do as quickly as possible. And so it made me think about, it's not just the person who needs to log in, it's also the patient experience that can be seriously impacted. And really, I think that identity management is less of an IT concern now and more of an operational concern, really. from what you've said. In Ireland, we do have a lot of those shared workstations, workstations on wheels, or WOWs, as people like to call them sometimes. What I have seen, just to give you some of the Irish context, there would be login fatigue. And so, that reluctance then to log in again and again and again, the temptation to walk away from a workstation and leave it logged in. And I know sometimes there are IT will force the log out of systems after a few minutes and things like that. But in the face of cybersecurity attacks which we've had in Ireland in the past, we need to get better at these things. We need to be able to digitally transform and make it as seamless as possible. And single sign-on, I think, is one of the ways that we can help with this, in order to positively impact on clinical care and improve patient flows. Given that the Irish environment is quite fragmented right now, and we are on a digital transformation journey, but as of right now, our digital solutions would be quite fragmented. So there would be requirements to log into multiple different systems many times per day. What are the challenges that usually emerge that you've seen in your practice, when you go into a new site where, they don't have your technology yet? What challenges do you typically see?
What we see is like there is many kind of disparate systems. They don't talk to each other, right? And I mean, other than the data not being able to talk to each other, also like we see like the user access also not talking to each other, right? So it's something that from the AuthX perspective we have been trying to solve, right? I mean, it's always going to be a challenge that any organizations will continue to face as they adopt standards, and even the standards keeps changing. So it's always a moving target. So can we have a system that adopts, right? Can we have a system that actually doesn't compromise users' access security as well as their productivity? Because there is multiple users and passwords, they're not similar, or they are not similar, and different ways to access them. And like when sometimes it's a web technology, sometimes it's a desktop application, sometimes it's a green screen applications. So, and there's multiple times you have to click through different applications, right? So not just being able to like give that single sign-on experience to the end user, right? Actually, like you log in with one of your primary identities and being able to like use that as a trusted source to being able to like access other systems with a single sign-on, if it's able to, or like being able to automate that login. So to a system and being able to launch those systems as seamless as possible. And so one of the things that also comes into play is like not just logging in and single sign-on, being able to have authentication workflows. So when a user logs in, okay, launch system A, launch system B, make sure system P is logged in, right? When I actually walk away, make sure like we close all those systems if needed, or log off those systems, right? So if some other user comes in and logs in, make sure the previous user A's access is logged off while user B logs in. So the authentication workflows, that what we call also like matters, right? I mean, how do we orchestrate that system to system access when a user accesses systems? So that kind of like that kind of a system matters, like an identity access system matters, because what people have been doing is, from the IT leaders' perspective, to trying to solve one problem, or they are bringing in multiple systems, and actually that adds to IT complexities, the cost of managing it, and also like ultimately like it impacts the clinicians' productivity as well as patient care.
Really interesting. And some of those challenges, I think, are something that we're really feeling here in Ireland. And it made me think about the risk. What is the risk of not having single sign-on? If we continue the way we are with an increasing number of digital systems that maybe don't integrate, or at least not yet. So we have multiple data sources, multiple systems across the continuum of care, and even single patient workflows. What is the risk of not looking to authenticate identity and create single sign-on in healthcare?
One thing we have to understand is like 80% of the breaches that happen or is not because of sophisticated attacks. They're actually because of the credential compromises, right? So the more credentials we have, like the username and password, that can be compromised easily, the security is at risk. So how do we make sure that the users usage of those passwords is reduced? It doesn't mean like you have to make the passwords complicated. That means people will start writing it down, right? And then there's more exposure, right? So having a single sign-on or having a simple ways to go passwordless, so that like you can just do a batch tap, or you can do a mobile authentication, and being able to do a passcode authentication, being able to use a smart tokens if you have to access the systems, right? Being that passwordless access with a single sign-on, and being able to give that trusted access to the systems has to change. I think and the amount of like there's some of the studies show that's an average of at least like about 20 minutes, 20 to 35 minutes saved per user in a day, just trying to access multiple systems. It's also, it can translate to about $1,500 to like $2,000 saved per year per user. So you can, like when you put it in perspective of the volume, like you can see the amount of savings someone can have by making the right choice, going passwordless with single sign-on.
Interesting. And on that, when you're talking about savings and things like that, what sort of KPIs are you looking to measure? You know, when you go from multiple passwords, multiple systems to a really good single sign-on and authentication system in healthcare, what are you looking to measure, or what should we be measuring?
Yeah, definitely like the time saved per user on an everyday basis and productivity wise, right? And also like if you look at the total systems ROI and the TCOs, it's definitely like we can take a look at, because people are using multiple IAM systems to solve it. So when you actually look at the total cost of ownership or the TCO, right? I think on the ROI that you get out of that it can be like more than 15x sometimes in terms of the security that you get, the trust you get, and the time that is saved for the clinicians on a yearly basis or on a daily basis, and as well as the patient, and it all results in patients' satisfaction, right? Yeah. So there is both the hard and the soft ROIs that we can look at, right? But I think the soft ROIs is something that is definitely like results in a better patient care. On the other side, on the hard ROI, definitely on the hard ROIs, definitely like the time that is saved and the cost that is actually like in implementing a simpler systems that can actually adapt as it goes will give you a long-term TCO also.
Brilliant. And of course, I'm guessing if we have that, good authentication, right person, right access, we're then more compliant with, well, here in Europe, we have GDPR, the General Data Protection Regulation, and also you'll be aware of the NIS2, that we all must comply with. And I'm assuming that if it's a good, secure single sign-on, then the level of security is actually increased and that risk is reduced. Would that be right?
That's correct. Yeah, I mean, the system should be able to like comply to the system. It actually adds on to the compliance. Like, can it actually give you all the? Can it actually give adhere to all the controls that all the NIS GDPR actually specifies, right? And making sure also like the HIPAA regulations. So having those systems that can actually scale, adapt to the compliances as it changes, right, as it improves, matters, right? And being able to like, can it grow as our scale, right? As the need arises, right? If the number of users increases or multiple organizations comes with different domains, right? Being able to have multiple domains also, but giving the same state of security and compliance, right? So the technology is changing a lot, and being able to like having a cloud-based systems like AuthX, right, that you can actually implement based on the geographic regions if needed, right? So the GDPR compliance can be in place. So it's not like going to like something outside of the geographic boundaries, right, where data residency requirements have to be met in terms of compliance. And also being able to make sure there's a zero trust access, and being able to make sure the audit logs are available for the security and compliance matters, and real-time alerts, like feeding into all the security systems, so that way like people can be alerted of any of the anomalies or any things that they see is not supposed to happen.
Again, I'll come back to the Irish context. So in some hospitals, we would have electronic health records, but we also then have hospitals that don't, although they do use electronic systems for radiology, for patient administration, lab systems, and multiple systems that would each have, patient records on them for different purposes. And then, of course, we have the primary care side of things as well. At what point do you think it's important that healthcare organizations need to look at something like single sign-on? Is it before they adopt an electronic health record? Is it something that should be used for, if you've got two or more systems that are regularly accessed? Or is there a tipping point when it's important to consider something like this?
So, having multiple systems is sort of inevitable in today's digital transformation that the healthcare is going through. So it's like, I don't think a single hospital system can just work with one single system. So like, it's like every system will need it. As they adopt, they start getting digitizing and transforming themselves. Having a SSO solution is important. I think it's not a question of, okay, I will decide later. I think they had to start it together, because the time saved in implementing initially will definitely will save that time in the future, and the cost about remains the same. I mean, it doesn't change. So like, the cost implications are not going to are going to be more if you actually adopt it at a later stage, because now you have more systems to adapt to, more system complexity to solve, right? So you need to start as soon as possible. I think this is something that all IT leaders are, from the operations point of view, to see like, how can we keep that access easy while maintaining security and making sure the people are productive, while they actually bring in more and more systems, or switch between systems also. Even that happens, right? Where people are retiring a system and getting a new system in. It should not, other than managing that, transferring the from one system, transferring that data and that usage from one system to another, don't complicate users' access also, right? Keep it easy.
Yeah, keep it simple.
Yes.
And one of the areas that, and I don't know if you've come across this, but we would quite often have a hospital in a certain location, but there may be satellite clinics in different locations attached to that hospital, but different geographic location. And quite often it's very difficult to enable systems access to those remote workers because it's outside of the domain of the hospital. And the result is often that the notes are taken manually, and they don't have full access to health information, even things like, ambulance workers, paramedics, community workers attached to the hospital, physiotherapists visiting people in their homes, and also actual satellite clinics. With all of this ecosystem going on, perhaps connected to a hospital or a region, um, is the technology there to enable that single sign-on in multiple locations for the same systems outside of the walls of the hospital?
Yes, definitely. Like, I mean, most of systems are connected to the internet these days, right? So having a cloud-based system that's not actually on-prem, right? Because that's when actually isolations happen, when systems are at only one single location.
Yeah.
Having a system that's accessible from anywhere where the user moves, right? Especially with the being able to give remote care, right? Or it can be a mobile device, or it can be like a laptop, right? Um, and like having a cloud-based systems that can actually like serve different wherever people can access from, being able to restrict access wherever they're not supposed to access and where they can access from, and being able to adopt an authentication that say like you at the hospital, you can just use a badge tab. Let's say like you go to a remote location, you might have to do a multi-factor, right? You have so that I can make sure like you're accessing remotely. So systems like AuthX do exist, which can actually like do being able to support authentications across multiple locations, and for users being able to access across multiple systems, so they can don't have to have different credentials when they go to different locations.
Okay, brilliant. And now I'm going to kind of, this is a multi-part question, but in your experience, when you begin the journey with a client, going from multiple passwords, multiple systems, very large, complex organization, what does that transition look like for that organization to go from all of those passwords and systems to true authenticated passwordless single sign-on? What matters to them most? Are there any barriers that pop up, and how quickly do they see the value?
So it's I think it's I would say like it's very easy to implement a system. I think there's not when it's actually there is a system that can scale and adopt, can be implemented quickly, like AuthX. It's very fast. I mean, you can get up and running within matter of like days and weeks, and you can also start implementing them and passing out to the user in 30 to 60 days. I think you can see that ROI. I mean, you can see that experience that changes, the user adoption increases as soon as you launch it. I think that's the right kind of education to the users and showing them the value of like how easy it is to use. We have seen the user adoption like increasing more than 80 to 100% within like a couple of weeks of launching.
And having complete data is really important. Can you tell me about any particular adoption story or a case study that you can use to explain the journey for a typical hospital? Do you have an example of a user story, something like this?
So I think UPMC in Ireland is one of a good story that we can talk about, where actually, of course, they have the oncology centers where they're treating patients with cancer, and they do have multiple systems they have to access, right? And what we saw there was web-based systems, there was applications that was like they're probably like very old that I had to like log in with different username and password. Some had email and password, some had username and password, and people are using different passwords and usernames to log in, right? And not that every people had different systems, different access. Like and also we saw like there was some shared usage of username passwords also. So how do we avoid them, right? That's where like we were able to go in actually implement our AuthX with a batch tab solution, where we saw people were able to like you start using it, like they don't have to type in multiple username password or multiple times a day. We saw that usage just like increased, and people were like conveniently like stopped using those username passwords or sharing of username passwords in like matter of weeks. And that's one of the, I mean, and we see that story again and again with all the places we go to, like we launch, right? I think people are looking, okay, like sometimes they say, hey, this is not possible. Can we actually do a single sign-on to this? How do we do this, right? Or even like think of like, okay, if there's technology which actually prevents them from not being able to implement a single sign-on, I think they think about now is the time for them to change something, right? So actually they can actually make sure they can implement single sign-on.
Brilliant. Um, and of course, we talked a little bit about this, but the regulations are evolving as digital transformation is happening. The modernization of our health systems and advancements in technology and AI and all of those things, it's happening really fast. What should leaders prioritize over the next few years, and where do you see this type of technology going in the future? What's next?
Yeah, definitely one thing that has to change is usage of passwords. Adopting passwordless is now because it's a journey. It will take time, right? And people have to start implementing it now. And all IT leaders or CMIOs, right, from the operations have to think about how do we go passwordless.
Mm-hmm.
Adopting the right systems will help them make it easier as they scale and as they grow. I would say like if they don't start now, it will be hard to catch up later.
Yeah, good point. And kind of I'm coming towards the end now, but I can see that there is definitely a strategic mindset shift needed among our leadership in order to understand the need to adopt technology like this. What about the organizations who they may have some form of simple single sign-on, for example, and they feel like, well, we have single sign-on, we're fine. And it covers these 3 systems, but the other 7 systems over here, oh no, you have to log into those. What would you say to those? What is your experience of state-of-the-art authentication and single sign-on? What are the most important aspects of that to ensure a truly modern electronic healthcare system?
So, adopting the standards, I think, becomes important while keeping compliance in mind. As like I think choosing the systems that can actually like are on the forethought of actually are they going to implement the standards of single sign-ons? Are they going to implement the standards of OpenID or SAML or FIDO, right? That is, I think it becomes important. Or can they integrate into any of the IAMs that can work with it, right? Keeping the systems that actually like are thinking about it, not just like a functionality of just being an EHR and being able to, and the changing world of like, can the IAMs integrate into different ecosystems? Because the virtualization technologies are changing. There's not like only few out there. There are many out there, right? Also, like even the operating systems are changing. So it's not just Windows nowadays, right? There is thin OS and there's multiple flavors of thin OS that comes in, right? So because, and also like being able to like going into like mobile solutions, because mobile solutions are also like increasing, right? Being able to have that seamless experience and authentication experience across the board, whether it's using a simple badge tab to access, or a smart key to access, or even like using a biometric to access with the facial recognition, right? Having that adaptability from both sides, like system that's actually managing the identity and access, as well as the systems that's getting deployed for care.
Brilliant. And to bring that back to patient care and to the Irish context, my own background, again, I was involved with the regulator here. I'm working on healthcare identity for many years and developing standards around this for Ireland. So, from what you said, the technology, again, it's something that elevates our ability to deliver care, to improve the experience for the clinician, and to improve the experience for the patient. But not only that, and I think we've seen many cases where it is vital, it is critical that we have access to the complete care record when we're delivering care, that we understand things like allergies, that we understand diagnostic results, current medications. And these are things that you can't see if you can't log into all of the systems that you need to in order to have that complete picture. And it is with that complete picture that I think we're able to deliver best in class care. So you've actually, you've pointed out just how important this is. So it's not just a piece of technology to make things a little bit easier. It's actually critical as part of an integral part of clinical care. So thank you, Preetham. It's been a real privilege to speak with you today. And I hope you have a great day. And thanks everyone for joining us.
Thank you, Claire. It's a pleasure talking to you.